As you know, a lot of changes have taken place in the marketplace, and the role of the agent and the responsibility of the agent has to change for your survival, but also the great need of the business community to take on new tasks. And right now in 2000, end of this year and above, the business community at large has new responsibilities. The first 2 years of the Affordable Care Act was primarily focused on the individual. And obviously, many of you who have worked with the business community or individuals have seen a change in how you do business. But now we're going to go through the most radical change in the marketplace for the business community. And so what we have done, and hopefully you all are considering, taking a look at how your practice works and to develop new ideas to accommodate the needs of the business direction. So I have in today's meeting 3 panelists, along with myself, that we're going to take on some of the new things and trends that are necessary in the marketplace for you to survive and grow. And sitting down and starting with Monica Gwynn. Monica is really working with us on the area of compliance. And many of you now are probably getting questions from your employers about the future of their business and the need of new compliance. Most of you know that companies of 50 and above now have a whole new way of looking at things. Companies from 50 to 100 lives are no longer a large group. They're a small group for quoting purposes and everything else. That's going to greatly affect that marketplace. So Monica, why don't you sit down? Yeah. And next to Monica is Tony Strategis. Tony and I have been very successful in developing a new strategy that's important. How many of you know the business community that you work with a business owner wants to control the activities that they deal with? And one of the issues that has really not happened directly is group health insurance for small groups, primarily of under 50 lives. The controlling factor of that marketplace is not the owner of the business. It's the insurance company you choose. So an example, if you have a plan and you know that your employees have had very little utilization, does that employer get any break from the insurance company? Can any of you experts in this room tell me that? The answer is no. And what you're seeing is constant trends in rate increases of 8 to 10% consistently, putting a strain on the business, forcing higher deductibles. Well, we're going to have another direction, another thought, another part of the process that Tony's going to talk about. So welcome, Tony. And in the back that will be coming in is Dr. Louis Iorio, a well-known surgeon here in Connecticut, but has a mission on properly executing wellness. Most chambers of commerce, as you know, have been promoting wellness, but most of them are not helping the business community take advantage of something that was part of the Affordable Care Act and allowing companies to properly execute a wellness program for their company and gaining a tax deduction for that wellness program. So I've been involved with all across the state with many chambers and doing wellness things, but unfortunately, no one is taking the message about the ability to provide subsidy to the employer on wellness. Another door opener, another direction that many of you in this room have the opportunity to deal with. So what we're going to do is share some of these. By the way, we've enhanced our portfolio of products. You know that we work with 3 of the major carriers now, Aetna, Healthy CT, and Harvard Pilgrim. We're very pleased to have a unique disability program, not just traditional disability as we know it, but we do have that with a company that many of you know as Emeritus, but with a substantial discount, which also will allow the opportunity to things like overhead expense plans that are greatly needed, and special plans around that that can be used as a gap within a group health plan, or a health plan, we call it a fundamental plan, that can provide, if someone became disabled, a full lump sum of their income for a year. All of this program is reduced because if a company is a member of a Chamber of Commerce. So there's opportunities that we see for all of you. Obviously, the exchange is now growing and doing its thing, but many of you today realize that in order for you to be financially sound today, you need to be more creative and you need to work with a different type of market within the same realm of your activities, working with business people. Survival of the agent in this level of market is what's necessary. So we're going to start off with some comments from Monica on compliance and some thoughts around that. And again, working with us and Monica, there is a discount of her programs for Chamber members. Plus we have legal counsel in our office and others relevant to compliance as well. And then we'll move on to Tony, and then we'll move on to Dr. Louis Iorio on that. And welcome to everyone. Thank you. Okay, Monica.
Thank you so much for having me today, Steve. So I'm from Task. I'm a regional sales director for the state of Connecticut. We are out of Madison, Wisconsin. We're the largest privately held third-party administrator of compliance and benefit administration. We have 20 different services, and we'll just do a quick overview of compliance for 2016. All of this is really due to the ACA, and it has really shined a light on businesses, as you know, and a lot of that is why we're here today. Some of it is really about ERISA. A lot of you know that as retirement plans. However, it also is subject to health and welfare and benefit plans. All businesses who offer group-sponsored health plans must have an ERISA summary plan description, and they need to distribute that to all of their participants. So if any of you guys offer a group-sponsored health care plan to your employees, you've got to have an ERISA, not from the carrier, but an ERISA summary plan description, or what's called a wrap document. Now that's for all employees, all employers, no matter the size, if it's group sponsored. Now for 2016, we have new regs that came out. This is the employer known as pay or play. So a large employer is now considered 50 or more. It used to be 100, it's now 50. You're now subject to what's known as 60, 55, and 60, 56. This is the IRS sections that were added under the ACA. This is not tax filings. A lot of people get confused and think these are tax files. They're not. This is IRS sections. It's known as the Employer Shared Responsibility Mandate. What it is it is a way for the government to be able to see who is eligible for subsidies and who is not. If an employer is offering affordable coverage for health care, an employee is going to the exchange and getting a subsidy, the employer and employee can be held liable and will be fined. So it's important to keep that in mind. So for 2016, there's reporting requirements that need to be taken into effect. From reporting, look-back periods, measurement periods, administrative and stability periods. And all of these things can be looked up right on irs.gov. So there's a lot to take into account when you have part-time employees, variable hours, seasonal employees, anything like that. So for companies that have 50 or more employees, please make sure that you're tracking those hours, and that the employees know that they cannot go to the exchange if you're offering affordable health coverage, because there are repercussions. Now, the filings for employers are this. If you offer self-insured health coverage, which we'll get into, I believe, in a few minutes, all employers must file tax filings, no matter what the group size is. If you have 50 or more employees, you must file what's known as 1094, 1095C and 1095C. Sorry, 1095C and 1094C. My apologies. This will be due by January. To get into compliance will be January 1st, 2016, and then the filings will be due March 31st, 2016 if you file electronically. The fines start at $100 per day per employee that the filings are not completed. And that's for the ACA Section 6055 and 6056 for employers that have 50 or more full-time equivalent employees. So this is new for 2016 under the ACA. So it's a lot of information. I can't go over all of it now. If anyone would like more information, they can absolutely contact me. We do webinars, seminars, and courses. Thank you so much.
Again, Monica, thanks for your points. Again, a new opportunity and a really key responsibility for people like you to help companies. This whole transaction and the fines and other things that are going forward, without good information, would be there. Unfortunately, there are not many people that are approaching the business community, even at this late stage right now. What we look at is the opportunity to help them and make them aware. We are working on a major franchise association, primarily in the restaurant industry. The average amount of employees covered by their coverage, some of these employers cover 300 employees or employ 300 employees. How many employees do you think have health insurance today out of that 300? Less than 10%. Think of the implication to them. What happens if you decide, and this community decides to work together to communicate this information to that employer? Which leads to our next speaker, Tony, to describe a solution that is kind of unique. Obviously, we work with 3 major carriers. Unfortunately, the carrier alone cannot solve the problem, because part of this solution is offering some alternatives that are really not profitable in the eyes of many of these carriers. So I'm going to let Tony share the 3 elements that are important. There are opportunities for you to work with us and strengthen the chamber community to alleviate these severe penalties on them. Tony?
Thank you, Steve, and good morning, everyone. I've spent enough time on your side of the table, so I'll try to make this as interesting and upbeat as possibly can. ACA, for so many of us in the industry, initially looked like it was really going to unwind our world. And in some ways it certainly has, but I can share with you, out of chaos always comes opportunity. And there are tremendous opportunities still out there. Chatting with a couple of you earlier this morning, the value proposition of what you do on a day-to-day basis does not go away. Irrespective of what the feds are trying to do and what the intent of the law is, really qualified individuals that can guide business owners in what is really in their best interest will never go away. So there's a positive side to all of that. That is it. So the ACA, as you know, has a myriad of 7,500 pages, of which most of Congress, as we all understand at this point, has yet to delve through all of that. has, unfortunately, they'll put a considerable amount of responsibility on employees and employers. So stop me when I'm, again, boring you or stuff that you already know. So let's start with the employer mandate, right? So the pay or play component, as Monica alluded to earlier, if an employer is not offering benefits, obviously there's a $2,000 penalty, and or if he or she is offering benefits but it is not affordable, then there's an additional $3,000 penalty. That's the employer side. Now there's the employee mandate. The employee mandate is that employees under the ACA are required to have health coverage, or they face a penalty. This year it's fairly innocuous, about $325, or 2% of their income. Next year it jumps to minimally $695, or the greater of 2.5% of their adjusted household income, plus $347.50, don't hold me to that exactly, for each dependent that they have. Okay, so what's the intention here? Well, if you want to legislate behavior, you do it through penalties, right? And that's how the government is, in essence, driving people, some would say forcing people, into purchasing coverage. Okay, all right, so we get it. Now, the reality is if you look at certain market demographics, as Steve was alluding to before, we're working with a number of franchises and associations where they have hourly employees that are at minimum wage or barely above minimum wage. Putting gas in their car, putting food on the table is really their priority every day when they get up. It's not about health coverage. I get the importance of having it. Everyone understands that, but it's a balancing situation, right? So how do you help these individuals? Where does that help come from? Well, according to the ACA, these folks are either going to purchase coverage through their employer. The employer must offer a minimum value plan whose employee contribution does not exceed 9.5% of their annual income. Okay, so let's run the numbers, if you will. Let's assume someone's making $10 an hour, and that's well above minimum wage for all states as far as I know so far. And they're working their minimum 30 hours a week, which is what is required for them. You have to be working 30 hours or more in order to have health insurance in place. So that's $300 a week times 52, that's 15,000, let me do my math right, 15,600. Okay, I'm going to round up because I'm not that good at math. We'll call it 10% of their income is $1,500, and $1,500 is what their contribution needs to be. This is $1,500 net of taxes, right? So you got to gross up to some number to get to that $1,500, but it represents, again, 9.5% of their income, or $135 a month, roughly speaking. Okay, well, let's assume for a moment that they are going to make the sacrifice of reallocating $135 of what's already a very bare bones budget for them to survive on a day-to-day basis, and they're going to buy coverage. The employer then is covering the balance of that amount. So if the employee rate is, say, $400 a month for a bronze plan, the employee is responsible for $135. The employer is responsible for the balance of that. So let's talk about an employer, as Steve was alluding to, and we have a number of these that have 300 employees, and candidly, in one case, they have no health coverage in place. What does that number look like for them now? Right, they've gone from, okay, we're surviving, we're in business, we have, in this particular case, 5 locations, we have 300 employees. Now all of a sudden, I've got to look down my census, I've got to look at full-time and full-time equivalents, I'm exceeding that 50 minimum participation, full-time employee, I've got to start offering a plan now. Okay, so great news for brokers, right? You've got a attentive business owner that was kind of letting this thing go by the wayside before, now can't because he or she's going to be facing a significant liability, financial liability. Just so you know, and maybe you do already, that fee penalty of $2,000 for non-participation, $3,000 for not offering a minimum value plan that is affordable is an after-tax fee, right? It's not a business deduction. So that employer cannot deduct that money as an ordinary expense day in, day out. So that actually ratchets up that number a little bit more depending on what tax bracket that employer falls into. The employee, if they do not participate and purchase coverage, pay that $695 to really, it could be as much as $3,000, depending on household income and number of dependents. The maximum right now for 2016 is that penalty cannot be greater than $2,000, almost $2,100 plus the $347.50. So if they have 3 children, you're at that $3,000 level. That's in an after-tax basis. That's not a tax deduction. And I know all of us Americans are honest when it comes to filling out our tax returns. I know it. But I'm going to share with you right now, the last thing you want Uncle Sam doing is raising a red flag on your tax return because you have not purchased health care. Right? So let's get off of that component for just a second and just remind these employees the importance of this. The reality, though, is that the intention of the law was well intended. Its execution is less than favorable to so much of our society, unfortunately. So what was the solution for us? Well, there are 2 components. There is a minimum value plan that must pay 60% on an actuarial basis of all health expenses for an individual. The individual is only responsible for 40%. And then there's minimum essential coverages, right? There are 3 different categories that the ACA has broken this down to. Adults, women, pregnant women, children. And each one has its varying levels. As if you've all taken the time, and I imagine it was on a night when you had insomnia and read through this stuff, it's really wellness benefits, right? Typically, you get an annual physical at no charge. You get some preventative screening. Women get contraception, prescription drug medications. It's a lot of wellness, certain immunization shots, cholesterol screening, and so forth. If you have a runny nose, you're not going to get any coverage, right? If you break a bone, you're going to pay for this out of pocket. So that is, but if there's a silver lining to this, if an employee purchases a plan that has minimum essential coverage in it, he or she now waives or is not going to face that $695 to $3,000 penalty, right? They generally are not at that point also going to go to the exchange and receive any kind of subsidy, so that helps the employer out from the $3,000 penalty. So what have we done really at the end of the day? I have been in meetings with employers who are really looking just to check the box. Let's get through the census, let's get the waivers done so I can say I've offered coverage, they haven't chosen coverage, I'm out of the $3,000 and $2,000 penalties. But we also have many that are saying, I really value my employees and want to help them. We should be doing something for them. Let's offer this and help them through that process. So what we've designed and developed is a minimum value plan that meets all the criteria of a bronze plan that the ACA has under a level funded platform. So how many of you have done level funding or do level funding? A couple of you. How many of you do self-funding? Partially or fully self-funded? Partially, okay. How many know the difference between partially and fully self-funded and level funded? Anybody? Okay. Here's it in a nutshell. Level funding is no different than a fully insured contract because it provides stop-loss coverages. The employer knows what his or her monthly premium is going to be. Any claims in excess of that monthly contribution is paid by the stop-loss carrier. Good years, there's claim fund reserves. If there's money left in it, the employer gets that money back. Bad years, no harm, no foul. The stop-loss carrier picks that up. That's the only difference. There's no great mysteries. I will share with you, you get outside of New England, people know what self-funding and level funding is. In New England, we're the last bastion of these groups of very talented brokers that are still engaged and entrenched deeply in the fully insured world. The good news is that that's changing, and it's changing because it is providing you as a broker now the ability to sit down with a client and go, here's your traditional meeting with your client. Here's carrier A, here's carrier B, here's carrier C, here's your plan, here's your census, here's your claims data, here are your premiums. Pick one. And where is the real thought process in that, really? Where now you can see why someone might question the value proposition that a broker brings to the table if really all I'm getting is spreadsheets of 3 carriers giving me the same benefits, and the price is going to vary how much today, given that they're filing rates? 3% maybe, 2%? Okay. So where does self-funding or level funding really bring you a real game changer is the ability to share with the owner a couple of things. First and foremost, transparency. There is no transparency in the fully insured world today unless you're a 100 life group, right? You get no reporting. The employer has no sense as to where his or her money goes when they submit that premium on a month-to-month basis. Okay. Level funding, whether you're a 10 life group, because we'll go down to 10 lives.
That's very important.
Irrespective of how many employees there are, we have no minimum participation. So if you've got a 40 life employer group and only 10 of them are on the health plans, we'll go ahead and quote that. We do need health statements. That's reality. We're individually writing here. Good news and bad news. The good news is if you've got a really good demographic group, fairly healthy, the rate that you're going to see typically is going to be much better than the rate you're going to see on the fully insured market. Everyone understands the concept of pooling, right? What has the ACA done is really nationalized a high-risk pool. Let's not, mince any words here. That's the reality of it. You've got guaranteed issue. You're accepting everyone, and there's no pre-existing conditions. Great. That's terrific. That should have been the case. But that comes with expense, does it not? Right? As an actuary or an underwriter, if I'm looking at someone coming in I know has got a 5-year window of cancer treatment, I know what that cost is going to look like. If they've got pending open heart surgery, I know what that expenditure is going to look like. I've got to absorb that in my premium, right? At the end of the day, there's no steeples on the top of any one of these insurance companies. They're all for-profit companies. So they have a responsibility to make sure that they price these plans out. So if I change the market, which is what the ACA has done, from being able to get some sense of who I'm insuring to no sense and accept everyone, the rates are going to change, and they have changed, and they will continue to change because of that risk pool. Well, so when you bring a group to one of the fully insured carriers, they're looking at that group as a small microcosm of their entire pool. Some sections of that pool is murky, other sections it's crystal clear, but at the end of the day, it all gets mixed up together, and the pricing is reflecting that. What happened to composite rating lately? Went away, right, in the smaller group? So you sit down with an employer says, okay, I've got a 20-year-old EE rate, employee-only rate, and I've got a 45-year-old employee-only rate. They're like over here. How do I figure out what my contribution level should be or will be going forward? So composite rating is still in full play with us as well. So that's a value add that you can provide there. All of our stop-loss carriers, real quickly, are A+ rated stop-loss carriers. There are others out there like us. There's no secret there as well. I think some of the things that really distinguish us are a couple of things. Number one is we don't market your census and your RFP to us to one stop-loss carrier. We will send it to 4 to 6 markets. Why? Because we're in the same business you're in. We're trying to get the best for our clients. You're our clients, so we're trying to do the best for you as the broker. You go to any other level funded carrier out there, and they're marketing it to themselves, right? I mean, they're the carrier. They're not researching the market there to see where there's better pricing capabilities for you. Network-wise, wide open. PHCS, Cigna, First Health, we're not limited. It's really determined on where that employer is segmented and who provides the best coverage for those individuals. PBM, CVS Caremark, fairly straightforward. We don't keep any of the profits, by the way. We send that all along. But importantly for your employer is he or she, every month, whether it's a 10 life group or a 250 life group, will get detailed, to ad nauseum detailed reporting on where every single dollar is spent. They will know exactly, good or bad, what you're getting paid, what we as a third-party administrator are getting paid. They're going to know what their network access fees are. They're going to know every single dollar that goes to RX, to hospitalization, to physicians, to x-ray. It's all a detailed report. That is critically important, I believe, one, because how do you run a successful business when the second largest expenditure on your balance sheet is something you have no idea what's going on with it? You're just going to assume year in and year out that your health coverage is going to go up by a double-digit growth. And in the last 18, 19 years, what's been the increase in healthcare coverage, premium costs? About 270%. At the pace that it's continuing today, in the next 4 years, the cost to an employer for benefits for an employee will exceed the average salary that that employer pays that employee.
So let me stop for a moment because I want to spend some time with Dr. Iorio. Look at where we are. Look at the opportunity. Talking to an employer, the bottom line is, for the first time under this scenario, they receive information, they have an opportunity the following year to actually get a rate reduction. Could be 15 to 20% or higher, but 100% of that rate reduction goes back to the employer in the year. How many small groups that we know get money back legally against their insurance? And technically, right, Tony, one out of every 5 years, there might be a blip. So 4 years of rate reduction, maybe 1 year with a challenging increase. And the worst case scenario is this: they can always go back to a fully insured plan without any problem. Think about, with our training and direction, think about the opportunity of talking about this with any company with 10 or more employees. Most of the carriers that will be introducing this program will start at 50 and above. And they're all getting their face wet for the first time. It's new direction for them. You can be a leader, and for the size company that joined Chambers of Commerce, you can give them ownership of their health plan. Leading to that, with information about healthcare and everything else, there are other things that an employer can do in the area of wellness. And Dr. Iorio or Lou, can you share your thoughts? And then we'll come back to Q&A and wrap this up based on the time constraints that we have.
Sure. Well, thank you for inviting me here today, Mr. Glick. It's always a pleasure to be part of the innovative programs and ideas that Mr. Glick brings to the business community. I'm also grateful because he asked my fellow panelists to do the tough part of telling you the bad news, and I get to tell you about some of the good news. So buried in the thousands of pages of the Affordable Care Act, there are actually some provisions that really benefit employers. And they fall under the context of the corporate wellness programs. Now, many of you, I'm sure, know the history of corporate wellness. Corporate wellness programs are part of what we do at ID Life. We're a health and wellness company, and corporate wellness is an important part of the programs that we provide. And I'm one of 4 physicians in the country who's on the Scientific Medical Advisory Board of ID Life, so I'm involved in those programs. To give you an overview of the evolution of corporate wellness that's taken place over the past few years, there have been a number of studies that have taken place to try and identify, is there measurable benefit, is there value to corporate wellness? Is there value to the employer? And equally important, is there value to our society and the economy overall? As many of you, I'm sure, are intimately aware, in 2010, there were 45 million lost workdays in the United States at a cost to our economy of $73 billion. Those are very substantial numbers that people take notice of, both our government officials as well as the business community. So as a result, corporate wellness programs were looked at as a possible answer to addressing these costs. Now, in the early evolution of corporate wellness, it might have started out as a purely educational program that maybe provided a newsletter once a month or some generic sort of information that was hoped to provide employers an opportunity to educate their employees about health and lifestyle changes that might benefit them and their families. Because as you know, 60% of the employer's health care costs is not on the employee, but actually on their family members. Well, when they looked at the effectiveness of that type of a program, what they found was that there was really no return on investment. And these were studies that were done both by the United States government under the Centers for Disease Control, as well as by the business community under studies commissioned by the United States Chamber of Commerce. So then they got to thinking, well, what if we add another component? What if we add a biometric component? If people actually had measurables, would that change the outcome? Would that change the return on investment? Well, it didn't. So then they got to thinking further, and they said, okay, what if we add a third component? What if we add a nutritional and fitness component? Would that change things? And sure enough, there were studies that demonstrated that once those three components were part of a corporate wellness program, then employers could expect to receive a return on investment of $3 to $6 for every dollar they invested. Well, at that point, we finally had some good news. And we had some good news that both the government and employers were anxious to embrace. So that good news, if you will, got incorporated into the Affordable Care Act. And under the provisions of the Affordable Care Act, there are subsidies that are available to employers who put in place corporate wellness programs that meet the requirements that are outlined within the Act. Now, those requirements include the three components that I mentioned to you. There has to be an educational component, a biometric component, and a nutritional and fitness component. If you have those components built into your corporate wellness program, you may be eligible for federal subsidies of up to 30% of the annual premium that you pay, your employers pay, for every participating employee. Now, using the national demographic, that adds up to $1,620 annually per employee. So that can be very big, significant numbers for employees. So with these provisions in place, corporate wellness has become more and more of an important component and mechanism by which employers can control their healthcare costs, because the subsidies, as Mr. Glick alluded to, are deducted from the bottom line. So we at ID Life are very proud to be associated with Mr. Glick in bringing these innovative programs to all of you. One of the things about the ID Life program is that we have designed it so that it incorporates all of the critical elements of the Affordable Care Act. Our program can be put in place either as a standalone program, or if you happen to be an employer who already has some components of corporate wellness in place that you might like or that have proved to be beneficial for you, and you may want to add the missing components, we can do that. And we do it in a way that's not cost prohibitive for any employer. The cost of participating in an ID Life corporate wellness program is $99 per employer, not $99 per employee, $99 annually per employer. So as a result of putting together a structure that incorporates all of the critical, foundational, important elements of the Affordable Care Act that allow employers to be eligible for these subsidies, and doing it in a cost-effective manner that doesn't make price a barrier to anyone, whether you're an employer with 10 employees or an employee with 10,000 employees. We've been very fortunate at ID Life that we currently are working with a group of employers that represent more than 30 million employees. And as a result, we've been able to develop a lot of innovative programs and approaches in association with people like Mr. Glick. So I'm just very proud and grateful to be here today and happy to participate in this excellent panel.
Great. Well, we now threw some ideas, direction. I firmly believe that the future agent today, who is a professional, needs to work in conjunction with the three elements that we just discussed. It's essential. The business community of the Chambers of Commerce are looking for you to knock on their door and to provide this type of information. What an opportunity. Not working with an individual alone, but working with a company. Companies of 50, 100, 1,000. Some of you need to just knock on the door and talk about these issues. So let's ask you a question, or have the opportunity for the next 15 minutes to ask the panelists anything you would like to ask. and maybe some suggestions. So hopefully that you again could support the work that we do to help you build your client marketplace today. Anyone have a question? I hope somebody does. Go ahead.
Recently, I bought a company in the Valley, and there's 8 full-time employees, and they do not offer any type of insurance program. And because some of the people know that I have a background in health insurance business, they all came up to me recently and said, "Can you help us? We don't have coverage." I mean, and they're all under the age of 35. And I said, what do you mean you don't have coverage? He said, "We don't have it. So we're afraid of what's going to happen in January 2016.
Right, Dave.
We're going to be in trouble." So one of the things I wanted to ask is, do the carriers continue to make, I guess the word would be make, do they make the employer continue to have a premium participation level? Or can this new company offer a group plan and say, listen, if you want it, you got to pay 100% of the premium or 75%? Is there still a minimum amount that the employer has to pay towards the small group premium? Or has that just gone off the books?
Dave, no, not on our side. We certainly would like to see some employer contribution, clearly, obviously, from a retention perspective, but there's no requirement, specific requirement. The only challenge you may potentially face is that you only have 8 lives and we need a minimum of 10.
Fine, too.
I'm sure you could. Now, does this employer only have 8 employees?
Now they have more than 8. Well, if you count the owners,
Yep.
it's over 10.
Okay.
Does your product be 10 eligible or 10 enrolled?
10 enrolled.
From the carrier perspective, you have to have some minimum contribution. Depending on the carrier, 50% of the employee, some 25%. So from the carrier perspective, there is a requirement of an employer contribution, being group insurance. Then on the other side, Dave, as you know, there is a question where employers have bought individual coverage and paid for it, and now as of June 30th, that cannot be done anymore. And Monica, do you want to have any comment on that, on the penalties? There are now strict penalties now on individual purchase for small businesses on coverage.
They can no longer give those funds to the employees to purchase individual premiums. It's because of the subsidies. Otherwise, they'll be penalized.
Anyone else think about an opportunity that we're talking about? Here's my dream, is that first you guys meet compliance, you develop a unique means of premium, the information and work on a level funded type process where the employer can get information about health care, not specifically, but on the general health issues, and then potentially bring in ID Life to help improve the wellness of that company. So ultimately, that company history will not blip and continue to get refunds from the level funded plan to reduce the cost each year. Most employers, our private carriers today, with good experience, they do not give a refund. And what happens, we're constantly being involved with additional rate increases, with the employer revising their plans with higher deductibles. It's an endless game that we play. But when an employer can see ownership, I was with an agent yesterday, a major business in a community, one that people look to. The owner of the company said, "You're telling me I have a chance to control my own plan? I'd rather take that risk than continue the way I'm going." And that's really a major message, Again, the unique thing is you need to at least bring that into your discussion and evaluate that along with the traditional marketplace. Your customer will appreciate that. And keep in mind, at least from our perspective, we have 3 of the major fully insured carriers that we work with, and now we're offering this 4th option that will solidify, I mean, I would believe out of 4 approaches or your evaluation, you should be able to satisfy the need of your customer, one way or the other on that. But I'm surprised not to hear more questions about compliance or about this. Go ahead, Norris.
In a level funding scenario, an employer will not often know about the health of his employees or perhaps their dependents. So you get potentially deep into the self-funding discussion, you get health statements. If somebody's got some major health issues going on that are expensive, what happens there?
Yeah, and that's a great question, a fair question. As I shared early on, it is individually underwritten. You're going to run that risk potentially. The group is either rated or declined based on the condition. So, and it's all about really how you structure your conversation. Yes, we are a tantalizingly different approach, but it has its weakness, if you will, and that's probably not the right word I should have used. But it certainly has a component of it that makes it a little bit different than what you're going to be seeing on a guaranteed issue basis on the fully insured market. So I always stress with the brokers that I work with is have a plan B in place and let your prospective client know that there is a plan B in place. The opportunity is to move them into an environment where they, as Steve said, take control of their insurance costs, see what it is that they're actually spending their money on, but that's only based upon the healthiness of their group, right? So each group is going to be looked at, obviously. Now, a lot of you are seeing on renewal that the carriers are requesting a personal health history on these employees anyways, right? We will accept any current health statement that you're receiving from any of the carriers today, as long as it's within 60 to 90 days of the new enrollment. So if you've got a form that's a year old, but the employee says there's no information here that's changed since the last year I've done that, signs and attests to that on a more current date, then we'll accept that going forward. And so we'll have a pretty good handle on it up front. What I will share with you is the simplest, easiest way in this process is, if the employer wants to see a proposal from us, we'll certainly provide an initial street rate. Better off getting the health statements up front. Say, listen, if you really want to see this as an option and really want to kind of change the methodology and how you're approaching your health coverage here, this is the requirement. It's a fairly innocuous health statement. You know, it asks for family health history. If it's an employee only, obviously just the employee and spouse, it would just be the individual that are going to be covered. Yes.
Is health one the only available way to do that?
Yeah, I mean,
It's offer telephonic, web-based.
we have it web-based. We have a fillable PDF that the employer can email to the employees. They can complete it on, and then send the attachment back to us.
And keep in mind, again, as a professional and to the business community, you're offering an option that they may not be used to. And again, it may not be right for them, but again, you're the person that's introducing it. And most people are not aware that a program like this can go down to 10 lives.
And what I share with every broker, that they should share this one statement with their clients. You're going to find out one of two things in this process on a level funded proposal. You're either being taken advantage of by the insurance market today because you've got a fairly good demographic group with fairly good health experience, or your health experience and your demographics aren't very good, and as much as you hate what you're paying, you're actually getting a bargain. That's the reality of it. Yep.
Any other questions? So let's summarize. Monica, do you want to say a few words from this? And please, we'll be here after to answer specific questions. What are some of your final comments?
Just that it's important for employers to be in compliance, to talk to your groups about ERISA summary plan descriptions, about the new tax filings, and just compliance before someone else does. And if you have any questions, please contact me.
Tony?
Just thank you for your time and your attention. Appreciate it. Any questions, please feel free. Reach out to Steve or to me directly. Thank you for your time this morning.
And Lou?
Thanks again for having me here today. I think as you've all heard, there's both bad news and good news. The good news is there are a lot of provisions built into the Affordable Care Act that can cost effectively benefit employers, and through the approaches that Mr. Glick is bringing to the table, corporate wellness is an opportunity that's available to everyone, and we at ID Life are happy to partner with Connecticut Chambers Insurance Trust.
And my final note is this. For the first time in a long time, being a member of a Chamber of Commerce has, again, a value to that business owner to be eligible and to understand ways of improving their benefit program for their employees at fairly controlled costs in today's marketplace. And one of the big things that we will be getting some very big news is for you as agents and for the public to understand. One of the biggest issues is health literacy. And we're one of the few organizations in the country, our wonderful Access Health and others are not doing this. Performing to the business community a means of health literacy so that members of the employees can begin to understand the terminology and directions. And all of you as professionals working will have access to the high-tech information from Consumer Reports in simple terms that will be available for you to provide and share with chamber members. And the idea of people can understand what a difference between a deductible and co-insurance and other things, usage, wasted usage, abuse of usage will be eliminated. And therefore, if programs like we're talking about today are in effect and people execute their plans properly without being lost or making mistakes and double book themselves in programs or make a mistake that is a difference between a co-insurance and a deductible and other things, the business community will again see opportunities of improving their coverage, reducing costs, and overall the country will see productivity reducing it. So the Simsbury Chamber of Commerce and others, we thank you for today's meeting. There's more to come from the chamber perspective to share general information to the public, and for the broker community that works with the chambers to be able to gain a new direction and thrive and help people who really want help from a professional, not from a computer. So have a great day. Thank you so much for your time. And please answer things. Thank you.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.